Hey guys, my name is Paige, and I'm going to be going over the disease muscular dystrophy today. So basically, I'm going to start by giving you a general idea of what it is, and then we will look at a more narrowed focus on a specific muscular dystrophy disease and the research that's been done and what its causes, different types of treatments, medications, how to exercise if you do have muscular dystrophy, which is extremely beneficial. There's a lot to go with this topic, so I'm going to try and present it to you as clear and as organized as possible. So let's start by looking at the definition. So muscular dystrophy is a group of inherited muscular atrophy diseases. So first, atrophy means basically the loss of muscle tissue. So when you have muscular dystrophy, it's basically a slow progression of losing muscle and becoming weak. And then with regards to the word inherited, you can inherit this from your mom. So we will go over how this occurs in the next couple of slides, but I just wanted to give you that general definition of what it is. Muscular dystrophy can affect many organs throughout the body, so the heart, muscular system, the stomach, many different organs throughout the body. And then I have listed here the 9 major types. So we're only going to focus on one, Duchenne, which is the one where the muscle protein dystrophin is defective and is not produced within the body. But the 9 major types of MD are Duchenne, myotonic, Becker, limb-girdle, fascioscapulohumeral, congenital, oculopharyngeal, distal, and Emery-Dreifuss. So just keep that in mind, and also we'll look at a couple more things about MD in general. It can occur at any age, but most commonly seen in young males. So a lot of people are like, why young males? This is because a child or a male inherits the X chromosome from his mother and a Y chromosome from his father, which is what makes him male. So each son born to a woman with dystrophin mutation on one of her 2 X chromosomes has a 50% chance of inheriting the flawed gene and having DMD. Each daughter of that same woman has a 50% chance of being a carrier for DMD. So it's the male that's affected and the woman that is often the carrier for the defected gene. And then depending on the type of MD disease, there's a lot of variability. So the muscles affected, rate of progression, and severity of the symptoms, which we will look at in a few slides. Here is a more visual description of how the son can be affected. So disease is inherited in an X-linked chromosome recessive pattern most likely affect the males because a second X chromosome usually protects the females from showing symptoms. So you can see there that the female has the double X's and the male has an X and a Y. So that X that the male has is what could contain the defected gene, and then the female carries it. So causes of Duchenne muscular dystrophy. So basically, DMD occurs when there is a defect in a certain gene. The muscle protein named, which I told you earlier, dystrophin, is defective in those diagnosed with Duchenne MD, and Duchenne muscular dystrophy is the most common and fatal in children. So that's basically what causes it. There was a study done prior to 1986. We did not know what caused DMD, but the Muscular Dystrophy Association supported researchers to do a study on DMD specifically, and so I have listed here what they found. They found the identification of a gene on the X chromosome that when mutated it causes DMD. So that gene is for dystrophin. This mutated gene fails to produce any functional dystrophin, and the lack of this muscle protein causes muscle damage and progressive weakness beginning early in the childhood. Next slide. This is more of a visual, which explains the dystrophin function of a muscle. So muscles are made up of muscle fibers, which you can see here. And each of these individual bundles of muscle fibers are surrounded by a membrane, which make up the entire muscle. So a group of interdependent proteins along the membrane surrounding each fiber helps to keep the muscle working properly. And when one of these muscle proteins are defective, in this case dystrophin, DMD is a result. Moving on, here's the symptoms. I know this is a lot on one slide, but I'm just going to read you what someone with DMD might present. So muscle weakness, clumsiness, frequent falling, difficulty getting up, waddling gait, curvature of the spine, drooling, eyelid dropping. So if any of those things are occurring in you or your child, it's often required or suggested to go and get tested. If you do have DMD, there's also complications which come alongside. So cardiomyopathy, decreased self-independence and mobility, lung failure, muscle tightness around the joints, and mental impairment. This is another visual that shows those symptoms. So you can see weak joints, so knees bent, weak muscles in the front causing a foot drop, belly sticks out due to weak belly muscles, sway back due to weak back muscles, shoulders and arms held back awkwardly. So overall, you can basically just see that that person is weak overall. Moving on. Currently, there's no cure for DMD, unfortunately, but there are a lot of treatments that have been proven to be helpful in slowing the progression of muscular dystrophy. So physical therapy, occupational therapy, and some surgical options, which just help to keep the individual active and prevent the muscles from getting tight and joints becoming stiff. Medications that these patients are often put on are corticosteroids, which slow muscle damage in patients with DMD. And then there's also many researching scientists which are looking into the treatment of this disease. So gene therapy would consist of injecting a healthy gene to those muscles affected with Duchenne to allow for regulated dystrophin production. Cell therapy, delivering muscle cells from a healthy donor, containing a healthy gene to Duchenne muscles to compensate for lost muscle tissue and to allow for normal dystrophin production by the donor cells. And then drug therapy uses drugs to treat the various aspects of disease pathology, including inhibiting the loss of muscle tissue and suppressing the immune system. Exercise. So this is what is most important in people with this disease. So although many children with DMD are diagnosed with or are wheelchair bound by the age of 12, they are still encouraged to exercise just because it has all of these benefits listed here. So increase in strength improves performance of daily activities. Flexibility reduces the progression of contractures, which are the shortening and stiffening of muscles when they aren't being used. So if you're sitting in a wheelchair all day, obviously those muscles aren't being used. So exercise gets them active and moving around and preventing any stiffness. Strengthening of postural muscles decreases the formation of scoliosis, which is really common in kids with DMD. And then it also increases energy expenditure, which reduces the risk for obesity. So kids who are sitting in a wheelchair all day often do not decrease the caloric intake just because they're growing or they don't even think of it. So obesity is often a risk. So if you don't decrease that caloric intake and you don't increase the energy expenditure, the result is often obesity. So making sure that these individuals with DMD exercise and keep active will equal that scale out. Let's look at a case study. So let's see, taking into consideration all that we have just discussed regarding DMD, the child inherited a mutant gene for dystrophin from his mother. He's 12 years old. He's a male. And he came in to me with a complaint of slow progressing motor impairment starting at 6 years old. So 6 years ago, he's 12. And so his parents informed me that he has been through many therapies. He's on corticosteroids. He's seen tons of doctors, and I think he's almost wheelchair bound. So I think the parents are trying to prevent that as much as possible and looking at other options. So they brought him to me, an exercise specialist who is going to create an individualized program for him to kind of put off getting into that wheelchair as much as possible. So we're just going to go through this chart that I have here. Let me see if I can, okay. So the three main areas of exercise that we're going to want to focus on is flexibility, endurance, and muscle strength. Flexibility is important, extremely important. You're going to do that every day just to keep those joints stretching, the muscles stretching, moving and active. Low intensity for each of these things, just because they're so weak in the muscles. You don't want to be straining them too much. You just want to keep their muscles active. 3 times a week for 10 to 30 seconds, you want to hold that stretch, and active or passive. So it can be static or dynamic. So they can be moving through, such as, walk, not Einstein, ghost walks. So when you kick your leg up, or you can just bend down, touch your toes, hold that for 10 to 30 seconds. Next is endurance. So each of these things are variable for DMD just because it depends on the progression of the disease and where each patient is at. So for this child, I gave him the variability of going 1 to 7 days per week, low intensity, 1 to 20 minutes, just depending on how he's feeling that day. And he can do any type of endurance, walking, cycling, swimming, anything that's going to be low intensity for him. Muscle strength, again, can be variable depending on how he's feeling. So if he wakes up one day and doesn't feel like doing it, he has a bad week, that's fine, but we really want to try and get that flexibility in no matter what. So, but with muscle strength, 1 to 5 days per week, low intensity again, 1 to 3 sets, consisting of 5 to 15 reps. And again, they can be holding, such as a wall sit, holding a weight in the air, things like that. And then below I have listed the flexibility. You want to target muscle groups where contractures are more prone to occur. So hip flexors, shoulders, elbows, wrists, things like that. Endurance, target muscles used to walk, just because walking is going to be the thing that they are most wanting to do, and that requires endurance. So target muscles, so like I said, walking, cycling, swimming. Muscular strength, target all the muscles. So overall, most of the time, DMD patients are just losing muscle throughout the body. So you want to target each of those muscles, those big muscle groups. So lastly, that's all I have for my case study. These are my references, and I hope you learned more about DMD, Duchenne muscular dystrophy, and that my presentation was clear. And I hope you all enjoy this weekend. The weather is beautiful.